So what is CKD? So what are kidneys? Kidneys are bean-shaped organs of the human body. So the human body normally has 2 kidneys. They are part of the urinary system and they are located at the back of the abdomen. So what are the functions of the kidneys? There's a lot. For example, first of all, they clean toxins from the blood. Second, they control the pH of the blood. Third, they create glucose when levels are low. And fourth, they produce hormones that make red blood cells. Next, let's dive into the parts of the kidneys. So in the kidneys, we have nephrons, renal arteries, and renal tubules. Kidneys contains over 1 million of nephrons, which is the filtering units in our kidneys. The renal artery in our kidneys controls blood flow into the kidneys, while the renal tubules reabsorb minerals into the body. So what are the causes of CKD and the symptoms? First of all, someone might be infected by type 1 or type 2 diabetes, or high blood pressure, or someone might be infected by glomerulonephritis, which is an inflammation of the kidneys filtering units, which is called glomerule, or someone might be infected by pyelonephritis, which is a recurrent kidney infection, or the interstitial nephritis, which is an inflammation of the kidneys tubules and surrounding structures, or the symptom might be someone is infected by polycystic kidney disease, or even vesicoureteral reflux, which is a condition that causes urine to back up into your kidneys, which is quite severe. Possible symptoms of kidney conditions, first of all, is nausea, vomiting, loss of appetite, fatigue and weakness, sleep problems, urinating more or less, which causes the urine turn to be dark, decrease in mental sharpness, muscle cramps, swelling of feet and ankles, dry, itchy skin, high blood pressure that is really difficult to control, and shortness of breath, and if fluids builds up in the lungs.
What happens with hemodialysis? We will undergo many surgery to make it easier to access your bloodstream. There are 2 procedures. First, arteriovenous fistula. The surgeon connects an artery and vein in your arm. Second, arteriovenous graft. If the artery and vein in your arm are too short to connect, the surgeon will use a soft hollow tube to join them. It will make the connection between your arm and vein easier to access during hemodialysis. In some situations, insert a catheter into a vein in your leg, chest or neck. It consists of rubber, silicone or another medical grade material. Healthcare provider will also teach you how to clean your fistula or graft to prevent infection. What happens during hemodialysis? Hemodialysis nurse or technician put 2 needles in your arm. After that, the hemodialysis machine removes the blood from one of the needles in your arm, circulates the blood through the many mesh tubes in the dialyzer. The dialyzer moves excess waste and fluids into a dialyzed solution. The hemodialysis machine eventually returns the filtered blood to the body through the second needle in the arm. During the session, the hemodialysis machine regularly monitors your blood pressure. You may adjust the speed at which the blood flows in and out of your body. Last but not least, after hemodialysis, the healthcare provider will remove the needles and kill your excess area. You may continue your everyday activities as usual.
CKD can progress over time to kidney failure, and we may also need to have a kidney transplant. So in order to prevent that from happening, we have many ways of it. First of all, if the person have a diabetes, they need to get their A1C level tested at least twice a year. And if that person have a high blood pressure, they need to check it regularly and get it under control, or maybe talk to their doctor about medicine that harm their kidney, and probably other ways to lower their blood pressure. In general, tips to get healthy kidney is by losing weight, be active, smoking, take all of their medicine as prescribed, stay in their target cholesterol range, eat fruits with lower intake of salt, eat more fruits and vegetables, and if they take alcohol, they need to know how to limit it, because alcohol can increase the risk of high blood pressure. Thus, high blood pressure can strain and scars the kidney, making the kidney weaker over time. And also don't forget to get your flu shot every year, because people with CKD have a higher risk of severe illness from the flu. Fun fact, we can also get tested for CKD because early CKD has no sign or symptom, so we may not know if we have it. The earlier we take the action to prevent or delay the kidney disease, the better it is. In conclusion, chronic kidney disease or CKD is more than just a medical condition. It is a lifelong challenge that can deeply affect a person's daily life, and it often starts silently with no symptom until the damage is already serious. Conditions like high blood pressure and diabetes, if not managed well, can slowly harm the kidneys over time. But with early detection, proper treatment, and healthy habits, we can slow down the damage and help people live longer and better lives. Taking care of our kidneys means taking care of our future, and it all starts with awareness, prevention, and the willingness to make a small but powerful changes every day.
This is our references. That's all from us. Thank you.